Do I need a PET scan to monitor lung cancer recurrence? Imagine you've finished your initial treatment for lung cancer and are now focused on staying healthy. You might wonder if a PET scan is necessary to keep an eye on things. The truth is, routine use of PET scans for regular follow-up is generally not recommended for most patients who have completed treatment. Instead, doctors usually relying on regular CT scans of the chest to monitor for recurrence. PET scans, specifically FDG PET or PET combined with computed tomography, are very sensitive tools that can detect metabolically active cancer cells. They are especially helpful when there are signs or symptoms suggesting the cancer might have come back. For example, if a patient develops new symptoms like cough, chest pain, or unexplained weight loss, or if a CT scan shows suspicious areas, a PET scan can help confirm whether these findings are due to cancer recurrence. PET scans can also help guide biopsies or assess the extent of disease if recurrence is suspected. However, PET scans are not usually part of routine surveillance because they have some limitations. For instance, they can produce false positives shortly after certain treatments like radiofrequency ablation or radiation therapy, which can make it seem like cancer is active when it's not. They also are less reliable for detecting brain metastases, so if there are neurological symptoms, separate brain imaging might be needed. Most follow-up care after lung cancer treatment involves regular CT scans. These are typically scheduled every 6 months for the first 2 years and then once a year after that. This schedule effectively catches most recurrences and new primary lung cancers. CT scans are good at monitoring common sites where lung cancer might return, including the lungs, lymph nodes, adrenal glands, and bones. In some cases, a PET scan might be recommended earlier or more frequently. For example, if the initial cancer was advanced or if there are ambiguous findings on a CT scan, a doctor might suggest a PET scan to get more information. Also, after certain treatments like radiofrequency ablation, a PET scan at around 6 months can help establish a metabolic baseline and guide future monitoring. It's important to remember that every patient's situation is unique. The decision to use PET scans versus CT scans depends on individual risk factors, the stage of the original cancer, the type of treatment received, and overall health. Your healthcare team will tailor your follow-up plan to best suit your needs, balancing the benefits and limitations of each imaging method. In summary, while PET scans are a valuable tool for evaluating suspected recurrence, they are not needed for routine monitoring in most cases. Regular CT scans remains the mainstay of follow-up care after lung cancer treatment. If you have concerns or symptoms, your doctor can decide if a PET scan is appropriate to help clarify your situation. Always discuss your follow-up plan with your healthcare team to ensure it's personalized and effective for your health.